All right, folks, let's talk about extensors of the wrist and fingers. You ready? Here we go. We're on page 135 in your book. And I'm going to have to go right to these because there are 4 of them, but actually there's more. There's just 4 that we list as extensors of the wrist and fingers because they have extensor in the name. Okay, that makes sense, right? So today we have extensor carpi radialis longus, extensor carpi radialis brevis, extensor carpi ulnaris, and extensor digitorum. They make up this big wad of muscle here on the extensor side of the forearm, which is going to be the posterior side if we're talking about anatomical position. Okay. All of these here that I'm making dance. Those are the extensors, all that group here, right? And remember, brachioradialis right here is the dividing line between the extensors and then the flexors. So let's get started with these. Now, you notice that they are extensor carpi radialis longus brevis ulnaris. Okay, what does that mean? Well, it means that they are going to insert on the carpals. See? Extensor carpi radialis longus. It's on the radial side. It inserts on the carpals. Carpi radialis brevis, same thing. It's on the radial side, inserts on the carpals. Carpi, actually not, well, this one's going to insert close to the carpals, let's put it that way. Carpi ulnaris, it's on the ulnar side. See what I mean? There's a pattern. Okay. An extensor digitorum is going to do exactly what it says it is. It's going to extend the digits, see? So extensor digitorum goes all the way down to the distal phalanges here, okay? So we have some different kinds of insertions this time. And here are all of the origins in black. Extensor indices we'll get to in a little bit. That extends the first finger. Extensor indices. But for now, we're going to focus on these. And then their insertions along the carpal set of the hand, and then, of course, the distal phalanges. So let's just move right along. Actually, nope, we're going back. Just kidding. I want these. There we go. Make them bigger so we can see them. All right. So extensor carpi radialis longus and brevis. So they both attach on the radial side, right? I mean, it's in the name, so they do. So longus originates on the distal 1/3, of the lateral supracondylar ridge. So right here. Brevis, on the other hand, originates on something called the common extensor tendon. The common extensor tendon is kind of what it sounds like. It is going to be an attachment tendon for several muscles. So it's kind of like the pes anserinus in that way. We're going to see this on the flexor side as well. But the common extensor tendon originates at the lateral epicondyle of the humerus, obviously. Lateral epicondyle of the humerus. So common extensor tendon from the lateral epicondyle of the humerus is the actual bony landmark there, okay? Now, these attach across the carpals. So they come all the way down the hand, on the radial side, right? Longus attaches to the base of the second metacarpal, which is right here because thumb is the first. So second metacarpal. And brevis attaches to the base of the third metacarpal. That's easy. So here and here. Longus, brevis, longus, brevis, longus, brevis. Right? No worries there. Okay. Now, as far as the actions are concerned, these are synergists because they're very close together. So they extend the wrist. They can abduct the wrist and assist to flex the elbow because they do cross the elbow joint. Okay. So let's talk about abduction and adduction of the wrist. On the radial side here, right, where the thumb is, abduction, oh, hold my arm still for a second. Abduction goes like this, okay? And if you were standing in anatomical position, that would make sense because you're actually moving the wrist or hand, whatever, away from the midline of the body. So you'd be moving it away from the midline of the body, okay? Adduction would be the opposite. So you'd be moving the ulnar side towards the body. Again, there are other terms for these, and I prefer to use the other terms because they're less confusing. In this case, we'd have abduction of the wrist is also radial deviation of the wrist. That makes sense. You're actually moving closer to the radius, right? Thumb side, radius. And adduction is also ulnar deviation, which makes sense because we're moving closer to the ulna, okay? But your book uses abduction and adduction, so that is what we use, but also know that it is radial deviation, okay? All right, so that's what we have here. It's extensor of the forearm, of course. I mean, it's in the name, but it's also an abductor of the wrist, which makes sense because you're attaching here and here. So it's close to the radial side. Radius will be here, close to the radial side. And if you're close to the radial side, then you're probably going to abduct, okay? Just as a general rule. Now, extensor carpi ulnaris, that is going to be on the ulnar side, of course. That is also going to originate on that common extensor tendon at the lateral epicondyle. But instead of going down the radius, it's going to cross the posterior forearm and insert at the base of the fifth metacarpal. So we are right here, base of the fifth metacarpal. We have extension of the wrist because it's in the name. But in this case, we have adduction of the wrist, which is ulnar deviation. And that is because of the insertion at the base of the fifth metatarsal. We are closer to the ulna here. Okay. Muscles that are closer to the ulnar side are going to adduct. Muscles that are closer to the radial side are going to abduct. Like I said, kind of a general rule here. It's going to work for our flexors and extensors. Then we come to extensor digitorum. Extensor digitorum originates at that common extensor tendon on the lateral epicondyle of the humerus. Easy peasy. But because it is going to extend the digits, it has to have insertion on the digits. And we do. Bases of the middle and distal phalanges of the second through fifth fingers, right? Because the thumb is the first, technically. So we have bases of middle and distal phalanges. So that's the base, 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 base. And then that's the base of the distal, base, base, base. If we go back up a little bit, we can see that. Our insertions here, and then the tendon makes a bit of a break. I can make that bigger. Tendon makes a bit of a break and then inserts at the base of the distal phalange. And the reason that the tendon makes a break there is so that you can do this without the tendon snapping. Oh. Right? So the tendon actually goes around a little bit and then inserts here. Goes around and then inserts here. Lovely. Okay. I'll make that a little bigger still. All right, so we have our insertion on the phalanges, which means we're going to affect the phalanges, right? Of course, it's in the name, extensor digitorum. So that's what it's going to do. It's going to extend the second through the fifth fingers. I mean, we don't have a lot of extension, but we have some. And I'll try to get my, nope, can't get my thumb out of there. Thumb has to be a part of it. Okay, just because it's there. See those tendons there? Do. Yes, you do. I know you do. And bony and tendony. This is extensor digitorum. Those are the tendons for it. Okay, you can see them on me. You could probably see them on yourself. That's extensor digitorum. So we have extension of digits 2 through 5, and we have assist to extend the wrist because, of course, it crosses the wrist, right? Yeah, absolutely. If it crosses a joint, it has to affect the joint, even if it's only assisting to do the thing. Okay. So again, here we are. This is the landmark for that common extensor tendon. They show it from an anterior and posterior view. Doesn't really matter. It's still the lateral epicondyle of the humerus. Okay, common extensor tendon goes for 3 of these muscles, right? Extensor digitorum, extensor carpi ulnaris, and extensor carpi radialis brevis. Okay, insertions are actually kind of easy. We have first metacarpal, second metacarpal, and then we have fifth metacarpal. So they're kind of right in a row. Okay, that's not so bad either. So let's take a look at the action here. Now, the one that is missing is extensor digitorum, but it doesn't really matter here. That's extensor carpi radialis longus. There's extensor carpi radialis brevis. What's this one? Yeah, that's extensor carpi ulnaris. So you can see it crosses the forearm to insert all the way down here at the base of the fifth metacarpal. Okay. And this right here, this structure is the extensor retinaculum. Remember that we had retinacula in the lower leg holding the tendons in place at the ankle. We have the same structures in the wrist. Okay, so that's the extensor retinacula of the wrist. All right, that's it for extensors of the forearm and hand, although it's not really it because we have a couple more. We have extensor indices, and we have some smaller muscles that move the fingers that attach down here in the wrist. So we will round back to that. However, for now, this grouping of extensors of the forearm and wrist, or forearm and hand, are finished. Have a good day.